Now, these are some of the very important points which I feel every patient should understand thoroughly before undergoing cataract surgery. Let's start with point number one. Once you have decided about the package, please be assured that the vision improvement is same across all the packages, and the only difference is in the postoperative power of glass that the patient will need. Now, this can vary depending on what type of lens you have selected for yourself. Point number two. In some special situations like weak cornea, poor pupillary dilatation, or weak support for IOL, additional material like iris hooks or a special viscoelastic substance like Viscoat, Helon 5 may be needed in the cataract surgery. Cataract surgery is essentially a painless procedure. In more than 95% of cases, no injection is needed for anesthesia. Anesthesia is given in the form of drops. Very rarely injection is needed if the patient is very uncooperative. Some patients, if they feel any difficulty during the procedure, should inform so that during the surgery some measures can be taken to reduce the pain. In some patients, unexpectedly, vision recovery is not total. Why does this happen? Well, if the patient has very dense and advanced cataract, it is very difficult to do a thorough internal eye checkup. Internally, we are mainly concerned about the health of the retina, where the image is formed, and the optic nerve, which carries our image to the brain. If any of these has some issue, then the vision recovery is not as per the expectation. Second reason for this is a condition called as lazy eye or amblyopia, which means that though patient's eye structure is normal, his eye is functionally weak from birth or early childhood. Some patients may complain of seeing black spots after the cataract surgery. Why is this so? For this, we have to look at the eyeball structure. The back portion of the eye is filled by a semi-solid jelly called as vitreous body or vitreous humor. This is present between the implanted IOL and the retina. This jelly keeps changing throughout the lifetime and develops opacities within it. These are called as vitreous floaters. Patients notice them as black spots which move with the movement of the eyeball. They may not be appreciated because of the cataract and poor vision, but once the cataract is removed and the vision improves, patient starts to see them as spots. These are natural, so best is to ignore them. With time, brain will learn to ignore its presence by suppressing their images, and only when you want to see it, you will be able to see it. Some patients complain of feeling of obstruction on one side of the vision. As you can see from the figures shown, on one side of the visual field they will feel an area which is dark. Now this condition is called as negative dysphotopsia, and it's because of an optical phenomena which happens between the new lens which has been implanted and the light which uh, enters the eye. Now this condition usually settles down over a period of 1 year. So patients really should not worry much about this, and this is a fairly common condition. Now, a lot of patients complain that they need to wear glasses after the cataract surgery, but one has to understand that the need to wear glasses after the cataract surgery depends on the choice of lens or IOL that the patient had made preoperatively. Each eye is unique, and in spite of best efforts, patient may still need to wear glasses after cataract surgery. Postoperative recovery usually takes about 2 weeks, but in some cases it may extend up to 8 to 10 weeks. This is usually because of excess body reaction to the cataract surgery and would mean a prolonged period of eye drop use. Some patients may develop a condition called as cystoid macular edema, where fluid collects in the retina. If you see the top figure, it shows the normal retinal structure, and a corresponding scan shows a normal retinal anatomy. In the second figure, there is a fluid collection in the retina, and corresponding scan shows swelling with empty spaces. Also, you can see that the contour of the retina has become convex. So, this condition needs treatment with a course of drops which may continue for a period of 3 months, by which time the condition usually resolves. Significant number of patients complain of foreign body sensation, irritation, and mild haziness in vision after cataract surgery. And this happens because of a condition called as dry eye. Now, there are multiple reasons for uh, which can cause dry eye. Of this, the most important cause is due to post-operative medication, which is needed for the recovery from cataract surgery, or patient had a pre-existing dry eye which was not having any symptoms, and now after the cataract surgery stress, it has got manifested. It's very important to understand that though this is a condition which causes a lot of irritation, due to which patient has a lot of mental stress, or patient becomes mentally upset because of that, it is a superficial condition of the eye surface, and usually with lubricating eye drops it settles down with over a period of time. Another rare issue that can develop after cataract surgery is PVD, or posterior vitreous detachment. This can happen at any time after cataract surgery, and patient will present with complaints of seeing flashes of light. This happens because of vitreous jelly which starts to contract. As it contracts, it separates from retina on its back side, and hence this condition is called as posterior vitreous detachment. Flashes happens because at certain points there is a strong adhesion between retina and the vitreous, which causes traction on the retina. Once the process of contraction is complete, vitreous completely separates from the retina, and that's the time when the flashes settle down. A word of caution in this condition is that in some cases, due to traction, retina may undergo a tear, which will need urgent treatment in the form of laser. Very rarely, this tear can lead to retinal detachment, so one has to be in touch with an ophthalmologist in cases where flashes of the light is the main symptom.